Pathogenesis of Oesophagostomiasis or nodular worm disease in animals. So if anybody asks you what's the pathogenic significance of Oesophagostomiasis or nodular worm disease in animals, you could say there is nodule formation. In extensive cases, there will be extensive nodule formation in the wall of the intestine, which is also known as pimply gut, that ultimately results disruption of the absorption, leading to different development of different clinical signs such as decreased growth, emaciation, and production loss. But the pathogenesis of esophagostomiasis starts with the penetration of L3 in the wall of the intestine. So two situations will be discussed here. The first one is animal without previous exposure of the nodular worm, and the second one is animal with previous exposure of the nodular worm. So in case of animal without previous exposure of nodular worm, the L4 will migrate in the wall of the intestine and there will be less or no inflammatory reaction. As a result, there will be no nodule formation in the wall of the intestine. And in this case, the L4 will migrate or will find their way to the lumen of the intestine, and in the lumen of the intestine there will be another molting, that is L4 to L5, and finally this L5 will become adult parasite. So the take-home message in this situation, that is animal without previous exposure of the nodular worm, there will be no nodule formation in the wall of the intestine, but more adult will be found in the lumen of the intestine. And in the second scenario, second situation, animal with previous exposure of the nodular worm, same thing, that is migration of the L4 within the L3 within the mucosa, and there will be a strong inflammatory reaction that will encircle the L3 stages of the parasite, and there will be more nodule formation in the wall of the intestine. In case of the sheep and goat, the size of the or diameter of the nodule is 2 centimeter, but for cattle it is around 5 centimeter, and the nodule will contain suppurative mass, that is yellowish or greenish pus, and this L4 again leave the nodule and they will start migrating in the wall of the intestine, and they will again start producing new nodule having the same content due to the inflammatory reaction. So there will be new nodule formation, and also this L4 will leave the migratory tract that will also contain the pus, that is content of the same nodule. So there will be extensive nodule formation, and this condition is called pimply gut. And this nodule will have some small opening, and through this opening they will leave the nodule and they will migrate in the wall. They will start migrate in the wall of the intestine, and sometimes some of the nodules will find their way to the intestine. So nodule will have the small opening through which the parasite will live and will migrate in the wall of the intestine. As a result, and in this case, few L4 will find their way to the lumen of the intestine, and there will be less adult in large intestine. That is, animal with previous exposure, there will be more nodule formation in the wall of the intestine, but there is less number of adults will be found in the large intestine. So altogether there will be nodule formation, and if there is rupture of the nodule formation, there will be hemorrhage leading to leakage of the blood into the gut, and this will contribute to the anemia, and in chronic cases there will be hyperproteinemia. And due to the rupture of the nodule, there will be ulcerative colitis and triphlitis, and if this condition doesn't heal, there is chances of perforation of the intestinal wall leading to peritonitis, and ultimately animal will die. And if there is perforation, there may be adhere to the other part of the intestine, and there will be lot of multiple adhesion, and this will lead to interrupted bowel movement. So due to the nodule formation or extensive nodule formation in the wall of the small or large intestine, so there will be disruption of the absorption, and this will ultimately lead to the uh, development of different clinical signs such as decreased growth rate, emaciation, and production loss.